Gumboro disease is a highly infectious disease that affects young chickens, turkeys, and ducks. The disease is caused by the infectious bursal disease virus IBDV, which is a member of the Birnavirus genus. The virus destroys the lymph cells within the cloacal bursa of fabricus, tonsils, and spleen. Significantly, there is no evidence of vertical transmission, parent to offspring between birds. Clinical signs and symptoms. Clinically, the disease is seen only in chickens older than 3 weeks. The feathers around the vent are usually stained with feces containing plenty of urates. IBD could, however, be observed as long as chickens have a functioning bursa, up to the age of 16 weeks. In chickens younger than 3 weeks, IBD could be subclinical, but injured bursa leads to immunosuppression. Also, diarrhea, anorexia, depression, ruffled feathers, especially in the region of the head and the neck, are present. The dead bodies are dehydrated, often with hemorrhages in the pectoral, thigh and abdominal muscles. The virus is highly resistant to most disinfectants and environmental conditions. In contaminated premises, it could persist 4 months, and in water, forage and feces 4 weeks. The incubation period is short, and the first symptoms appear 2 to 3 days after infection. The lesions in the bursa of fabricus are progressive. In the beginning, the bursa is enlarged, oedematous and covered with a gelatinous transudate. IBD lesions undergo various stages of serous hemorrhagic to severe hemorrhagic inflammation. The morbidity rate is very high and could reach 100%, whereas the mortality rate, 20 to 30%. The course of the disease is 5 to 7 days, and the peak mortality occurs in the middle of this period. The kidneys are affected by a severe urate diathesis. In an acute outbreak and manifestation of the typical clinical signs, the diagnostics is not difficult. The diagnosis could be confirmed by detection of typical gross lesions throughout a patho-anatomical study. The application of live vaccines in chickens is a key point in the prevention of IBD and should be related to the levels of maternal antibodies. Control and treatment strategies. There is no treatment for infectious bursal disease. Therefore, control and prevention are key. Rigorous disinfection of contaminated farms after depopulation has achieved limited success. If Gumboro is an issue, vaccination is the most effective control method, either through enhanced MDA in parent stock, through active immunity by means of direct vaccination of chicks. Vaccination policy against Gumboro disease tends to vary by area and the degree of challenge. In cases where the level of challenge is low, birds can develop immunity and vaccination will not be required. However, where vaccination is used, all protocols strive to provide passive protection to the hatching chick, followed by active immunization and a series of boosts in layer and breeder flocks.